Hi, so this is part 3 of our series on infertility, and today I'd like to talk to you about the most popular form of reproductive technology and its misconception. So we'd like to focus on IVF today. So IVF is in vitro fertilization, and it is one of the most popular and successful form of assistive reproductive technology in the world. And a lot of couples and patients take IVF as one of their saviors, and also the one cure for all for their infertility. They believe IVF can give them children despite their infertility. So I'd like to explain a little bit about how IVF works and what it can treat and cannot treat. So IVF is simply taking the ovum from the female patient, and then fertilization occurs in the lab with the male patient's male partner's sperm cells, where fertilization occurs in the lab with further cultivation of 4 to 6 days, and then reimplantation into the uterine cavity of the female patient. So yes, in fact, IVF is very successful, and it is a Nobel-winning medical technology and breakthrough. But in current day, it is blindly being recommended to almost any form of infertility cause and patient, because it is now becoming a money-earning business. It is earning a lot of profits for these type of medical institutions who are blindly recommending IVF to these helpless and also desperate couples. IVF, first and foremost, can only treat infertility that is related to fallopian tube disorders. So there are several types of fallopian tube disorders, but in general, if you have any problem with your fallopian tube, whether it is some tearing, some blockage, some swelling, some being filled with fluids or water, any issue with the fallopian tube, we do highly recommend that you go for IVF, if that is in fact the cause of your infertility. Otherwise, if your infertility is caused by other organic diseases not related to fallopian tubes, you may get pregnant with IVF, but your pregnancy will not last very long because of the underlying causes not being dealt with, which will lead to a stillbirth or a miscarriage. So let me repeat that again. IVF can only treat indications of fallopian tube disorders. If you have underlying PCOS, endometriosis, uterine malformation, pelvic adhesion, intrauterine adhesion, hormonal imbalances, if you do not deal with these primary causes, although IVF can make you get pregnant, which you already can do on your own if you do not have fallopian tube disorders, your pregnancy will not last very long because the underlying cause is not being dealt with. But in today's world, IVF is just blindly recommended to everyone. So I hope this video can be a form of education and also an eye-opening information for you and your partner to reconsider IVF before you go for your next treatment. Talk to your doctor and confirm whether or not your infertility is actually caused by fallopian tube disorders. If it is not, then IVF will not only waste your time, it will also waste your money and also cause potential secondary damage to your ovaries.